I have worked intake at Crestfield Walk-In Medical Centre for 11 years. My name is Webb. I am not a doctor or a nurse. I am the person at the front desk who checks you in, confirms your insurance, tells you how long the wait will be, and hands you a clipboard. I am good at my job because I am precise and I do not get rattled. On a Thursday in late November, approximately 4:15 in the afternoon, a man came through the front door and changed the way I think about the word ordinary. He was tall, dark overcoat, no tie, shirt collar open at the throat. He was holding his right hand against his side with the particular care of a man who does not want to draw attention to the fact that he is holding his right hand against his side. His face was composed, not pained, composed. There is a difference. A man in pain looks inward. This man was still looking outward. He was watching the room. He approached the desk and gave me a name, Marten. No surname offered. Date of birth. I entered it. He said, I have an injury to my right side. He did not say how it had happened. My job is not to ask. I noted that his color was good, his breathing was steady, and that he was going to be waiting a minimum of 40 minutes because we had 2 urgent cases ahead of him, and Dr. Rains was the only attending on shift. I told him this. He said, that is fine. He sat in the 3rd chair from the door. He did not take out a phone. 20 minutes into his wait, a woman sat down 2 seats away from him. I noticed her because she was not our usual demographic. She was wearing what I recognized as a laboratory coat folded over her arm. She had clearly come directly from somewhere and carrying a canvas tote with the corner of a printed report visible. She had been triaged with a soft tissue concern to her left forearm that turned out to be a contact burn from a heating element at the university research lab where she worked. Her name was Delia Ashworth. She checked in just after him. She sat down with a book and opened it. She did not notice him particularly. He noticed her fall asleep. She was sitting upright, book open, head tilted slightly toward the window, the way a person falls asleep when they have been awake since 4 in the morning, which I would later learn she had been. He watched her for approximately 10 seconds, the watching of a man making a practical assessment, and then he stood, crossed to the desk, and said to me quietly, she is going to drop that book. Is there somewhere I can find a blanket or a jacket? I said. I can bring one from the supply room, he said. Do not leave the desk. Tell me where it is, I told him. He went himself. He came back with one of the light fleece blankets we keep for waiting room patients. He draped it over her shoulders without waking her. He returned to his seat. He watched the room again. She slept for 22 minutes. When she woke and registered the blanket, she looked around. He was back in his seat, apparently reading a pamphlet about blood pressure management. She said, to the room generally, did someone? He said, without looking up the desk staff. I said nothing. He glanced at me once. I kept my face neutral. They called him before her. He went through the door. She waited. Dr. Rains, I could see from the front desk because the exam room door was left slightly ajar, spent approximately 35 minutes with him. I caught one phrase when a nurse asked if it had required stitches, and he said, 7. I could see his posture in the chair during the exam. Level, still, cooperative. The manner of a man who has had stitches before and expects to have them again. He came back through the reception area at 5:41. He stopped at the desk to settle the balance. He paid in cash. He asked me, while he was refolding his wallet, whether the woman with the laboratory coat had been seen yet. I said she was still waiting. He said, she has been here 2 hours now. He put $40 on the counter. He said, please see that she gets a coffee from the vending machine on the east corridor, on her way out if she wants one. That is from the desk. Do not say it is from me. He left. I gave her the coffee when she came through about 30 minutes later. She said, oh, from the desk? I said, someone left it for you. She looked at the door he had gone through. She smiled once, privately, like a person doing arithmetic. She said thank you and walked out. That was the full story as far as I knew it. 4 days later, a Monday, 3 men came in at 8:40 in the morning and asked to speak with the intake staff who had been on duty Thursday afternoon. There were 2 of them at the desk and 1 standing at the door. They wore dark coats. They were professional and completely polite. They described the man. They said, he was a patient Thursday afternoon. We need to know if he left any contact information or any belongings, I said. I can only confirm whether a patient checked in. I cannot discuss patient records without a formal information request through our administrative office. They looked at each other. One of them said, of course, thank you for your time. They left. I thought about the 7 stitches. I thought about the way he had held his hand against his side when he came in. I thought about the blanket and the $40. and the instruction to say it was from the desk. I did not pursue this further. On the following Wednesday, a courier arrived with an envelope addressed to Crestfield Walk-In Medical Centre, intake staff, Thursday afternoon. Inside was a short handwritten note. It said the desk handled a difficult afternoon with excellent professionalism. I am grateful. The note was unsigned. With it were $200 in an envelope labeled, Staff Discretionary Fund, no strings. I showed it to Dr. Raines. She read the note twice. She said, "Do you know who sent this?" I said. "A patient who paid his copay and left," she said. "All right." I put the $200 in the staff discretionary fund. We used it for the holiday patient gift bags in December. Juice boxes, crackers, hand lotion. The small things that made waiting a little easier. I thought about telling this story for a long time. I am telling it now because I want to say this. There is a kind of competence that goes unrecognized in places like a walk-in clinic waiting room. The competence of a person who notices a stranger sleeping and does something quiet about it. Who asks where the supply room is and goes himself. Who leaves coffee and says it is from the desk. I do not know who he was. I know that when 3 men in dark coats came looking for him on Monday, I told them what our policy required me to say, and I stayed calm, and I did not speculate. I know that he noticed her before she noticed the blanket. I know that when she did the arithmetic and smiled privately, she was right about something, even if she did not know what. I will tell you one more thing. When the 3 men were standing at the desk on Monday and asking their careful questions, Delia Ashworth walked in for a follow-up on her contact burn. She passed them in the doorway without recognizing them. They did not notice her particularly. I checked her in. She sat in the 3rd chair from the door. She picked up a book. I watched the door for the rest of the morning. I do not know why I did that. I think I was being careful. I think that is the right word for it.